Welcome everyone. My name is Jyot Chadha. I work at the New Urban Mobility Alliance, NUMO. We are a not-for-profit, alliance-based organization that is an outgrowth of the shared mobility principles for livable cities. We focus on the intersection of sustainable mobility and new technologies that have entered this market in the last decade or so. Really thinking about how to leverage these technologies to make cities more sustainable for sure, but also more just and joyful. So we have a 1-hour session today, which we're very excited about. And we're going to do the following. We have this absolutely wonderful panel. I've had a chance to chat with all of them before and work with many of them. I think you're going to enjoy hearing their insights and their stories. We're going to start off with a panel discussion focused on what they're seeing from their vantage points over the last year during the COVID pandemic. We're going to allow for the audience to weigh in. So we'll do a poll and get your sense of what you've seen, what you think is going to stick post-pandemic, what might change. And then we'll go back to the panel to react to what the audience feedback has been, but also do a second round of questions. So I wanted to kick off first with a bit of a pause. Leanne, could you change the slide for me, please? Thank you. So I was thinking about the last year from a personal perspective, and I think it's hard to meet anyone who hasn't really been impacted by this pandemic. And so I wanted all of us to just be able to take a 30-second pause. We're all sort of going about our busy days, and then we sort of jump into meetings and calls and sort of try to go about our business, as it were. But we're in very challenging times. And so take a moment, invite you to maybe take a few deep breaths. I'm sharing a small excerpt from a poem from one of the members of the Untold Stories of Liberation and Love Collective, which I believe is based in Detroit. So just maybe a few moments to reflect more. Okay, that's clearly not enough, but let's move on. Okay, so I wanted to first start by introducing you to the COVID Mobility Works platform, which is a platform that synthesizes and collects mobility initiatives that have kept the world moving through the COVID-19 pandemic. The platform was brought together to help policymakers, innovators, and advocates to rise to the challenge of providing access while addressing public health concerns over the last year, including thinking about economic and job recovery. The database on the platform has been put together by a number of organizations. You can see the list on the side over there. And includes over 500 mobility responses from over 250 cities around the world. So we invite you to play with the website, take a look at some of the initiatives that have been captured over there, and tell us what you're seeing in your cities and your part of the world that we really want to be able to document and be able to make visible to other stakeholders. Next slide, please. I also invite you to take a look at other resources by these great organizations. I think my colleague Leanne is going to paste the links to their databases or their resources in the chat box, so you can check them out as well. Next slide. Okay. All right, so let's start with quick introductions to our panelists. I'm going to ask each of you to introduce yourself, probably take a minute or two doing so, and let's go in order of the photographs on the slide. So Jacqueline, would you like to go first?
Yes. Good afternoon. I'm Jacquilyne de Camarillo, and I work for LA County Metro. We are the transit authority for Los Angeles County in California. I have worked for local government agencies implementing TDM policies for the last 30 years. And for the last 3 of those years, I've been at Metro. I implement and manage Metro's regional TDM program, which provides tools, support, and resources to the 89 cities in LA County, helping them to achieve their individual trip reduction goals.
Thank you. Josh, would you like to go next?
Sure. Hi, everyone. My name is Josh Johnson. I am a public policy manager with SPIN. We're a shared micromobility company operating in 4 countries, the US primarily, but also the UK, Germany, and then recently a few cities in Spain. With SPIN, I lead our work with data policy and also with external research partnerships, and was also formerly with the city of Minneapolis, overseeing our shared mobility work. So I have a bit of a unique perspective and have tried to bring that to kind of our partnership approach with SPIN.
Thanks, Josh. Ya-Ting?
Great. Hi, everyone. Good afternoon. It's so great to be here with you all today. My name is Ya-Ting Liu. I am a director of policy at VIA. We are a transit tech company that is essentially providing all kinds of digital and operational tools for public sector partners to really plan and deliver more accessible public transportation networks. So it's really soup to nuts, from understanding fixed route planning, where on-demand service can come and play a role and enhance the service, to really integrating multimodal transportation services all in one place. And so we are, at this point, have over 170 partnerships in over 20 countries around the world. And so excited to be here and jump into this really timely and relevant discussion. Thank you.
Thank you. Stacey?
All right. Hello, everyone. Good afternoon. My name is Stacey Matlen. I am a senior mobility strategist with the City of Detroit's Office of Mobility Innovation, where we work to understand how new mobility technologies can help Detroit residents get around. So excited to participate and be on this panel.
Thank you. Lucia?
Hello, everyone. Nice to meet you, and very happy to be here. I currently represent the city government of Buenos Aires. I am the chief of staff of the Transportation and Public Works Secretariat, and I am very happy to be here and share some of the Latin American perspective and what we've been doing in the capital city of Argentina to work with the COVID crisis and to foster the sustainable transportation.
Thank you so much. All right, let's jump off with our questions. So Stacey, I wanted to start with you, and maybe first we'll get some perspectives from the people representing cities here. So I wanted to begin thinking about frontline workers who have really emerged as the backbone during the pandemic and also during the recovery. How have you seen cities and transportation systems in the past, during COVID, and even present, sort of serving these workers? And what is, from your perspective, what are some of the key issues that have sort of come to the forefront in the last year?
Sure. So I think I'm speaking on behalf of Detroit, but I think I can speak on behalf of a lot of cities, saying that, COVID really affected how we view transportation in the city. And so in Detroit, we were a big hotspot in the beginning of March 2020, or middle of March 2020. And immediately, like many other transit agencies across the country, we had to reduce our service and imposed capacity restrictions to make sure both riders and bus operators were safe. But that then had negative consequences, where there were some, especially essential employees, who were left out waiting for a bus or being forced on crowded buses. And we knew that we needed to respond to make sure that the backbone of our economy, the people who are making sure that the rest of us can have groceries and making sure that we can have healthcare, that they are able to get where they need to go and in a timely way. And so we worked quickly to understand how to first understand the essential employee needs by reaching out directly to large employers, from our 2 large hospital systems to our grocery stores, and asking, can you help us connect with your employees to better understand what are their challenges? We can't go out in person and meet them where they're at, so we would like to connect with them to hear from their perspective. And so we were able to get over 300 responses in an enrollment form, which basically asked, where are you coming from? Where are you going to? What are your current commuting challenges? And what sorts of new options would you like to see? And everybody who filled out the form said they would definitely like additional options. And from that, we're able to gather some initial data to help us formulate how we're going to respond. So within a couple months, we were able to launch a few different programs. The first thing we did was we already had an existing first mile, last mile TNC pilot with Lyft, where we were giving people who worked late at night $7 credits to get to or from the bus stop to help them commute home. And so we essentially just expanded that pilot and provided larger credits and for longer hours at night to make sure people could get to and from work. And then we were able to create 2 additional new programs. One was an on-demand shuttle pilot program with VIA, where we worked to make sure people, especially essential employees, could get to and from work. We prioritized late night workers because that's where we heard there were biggest challenges, and then subsidized a limited amount of daytime rides. And that was really great to see. We had a lot of positive responses from that. And then we were also able to launch an e-bike and e-scooter leasing pilot, where we're actually giving out spin e-scooters and GM Arrive e-bikes with the help of local partner Mogo, and with funding from NUMO, and with thought leadership and partnership with NUMO as well. So it really was a large collaborative effort to understand how we can actually respond to resident needs in real time. And then all while launching these pilots, continuously texting and calling folks to understand, is this meeting your needs? If not, why not? And how can we improve? Some key lessons learned that we found, where we had hypotheses around potentially lack of data access or lack of debit or credit card could be a barrier. And what we found after calling folks is that actually that wasn't the biggest barrier to using these services. It was more so, especially when we were calling about the VIA service, there's concerns originally around, I'm sharing a vehicle with somebody else. I'm a little bit hesitant to do that. And once we were able to clarify how the vehicles were being cleaned and how masks were required, people were much more happy to and open to trying this service, which that was great to see. So we're able to reform some of the marketing materials and how we positioned our cleaning protocols clearly in the app. So changing that user experience. And then with biking, what we found is when calling people, there was, it really took that educational outreach of talking to people and asking them, what do you think about e-biking? And a lot of them said, I don't really know what an e-bike is. Can you walk me through it? And it took that real personal connection, that building of trust, to make sure we were able to meet people's needs and help them understand their options. And so overall, we learned a lot from these pilots, and moving forward, we're looking to expand on them and seeing how they can continue post-COVID in 2021 and beyond.
That's really interesting. And I'd love to, maybe when we can circle back to Stacey, understand a little bit more about how, as you're thinking about the future, what role data collection plays in your planning at this almost urgent level, and these quick ways of getting responses from community members and then being able to adapt at that level of speed. Would love to get your thoughts on that. But let's stick with the question, I think, of employers and workers. Jacquilyne, I'd love to actually bring some of your perspectives in over here in your role looking at TDM initiatives in the LA County region. Would love to sort of turn the mic over to you, and would love to understand, what you've seen in the last year, and as vaccines are starting to get rolled out, what are employers thinking about at this point?
So when we did our outreach to employers, we found two major things that they were concerned about. One that we expected was especially for those that have employees that are telecommuting. They've been home now for over a year. They're going to be eventually, phased back in. And how are we going to get those employees, especially those that have their own vehicles and have a choice in how they commute? How do we get them to not come to work in their vehicles? Even those that prior to being at home maybe took the bus or walked or bike or carpooled or vanpooled, they haven't done that habit for a year. They haven't had a commute for a year. And now suddenly they're going to have to get used to having a commute, going back into the office. If they're doing a hybrid where they're teleworking part-time and driving in part-time, they may think, oh, I'm not driving in every day, so I'll just drive my car. So that was a real concern. Also, employees expressed concerns about safety and taking the bus or carpooling or vanpooling. We expected that. What we didn't expect was employers reaching out to us and asking us what their liability is if they are actively promoting alternative modes, specifically transit, vanpool, and carpool. And many employers in LA County are regulated and required to reduce their employee trips by TDM ordinances. So they were in a hard place. They were required to still offer these incentives to reduce trips, and yet they were worried that if they offered these incentives and convinced their employees to take alternate modes and the employee got sick, would the employer be liable? So that is something that we didn't expect. And so what many employers were doing was keeping their programs intact, especially if they had a lot of essential workers or they still had workers coming into the office, keeping their programs intact, but not marketing them and not really putting any effort into them. And then that led into, once employees come back, how do we maintain our trip reductions that we're now gaining through telecommuting that are going to disappear? So the employers are in a very difficult spot. Metro as an agency, we can't give legal advice, but we did turn to our legal because we thought, well, if we're promoting the same things, does that put us in a, in some kind of a liability? We decided that it didn't for us. We advised all of our employers to talk to their legal teams and make sort of that decision on their own. But in order to support them, we came up with a few things. One was we went to the CDC website and looked at their guide for safe commuting, which really does have guides for every mode imaginable. It's not just transit, it's also bike share, scooters, it's using things like Uber and Lyft, it's carpool, vanpool. So they have really great guidelines, and we're working with our marketing team to create a guide for each mode, and it will say that this is based on the CDC guidelines. And we also encourage the employers to let their employees know that they have the choice to choose whatever mode they like to commute in, and whichever mode they choose, please be safe. And here are some guidelines on how to be safe. Now that more and more people are getting vaccinated, I think hopefully by the time people come back to work, there'll be people will feel more secure in other modes. I think once we get through the fear of being in a space with so many people, like you're in transit where you don't have control, then there's the other part of that equation where people have been not commuting for a year. And if you own a car, it may not be the quickest way to get to work. It may not be the most cost effective or the least stressful, but it is the easiest. It's always very easy just to get in your car and go. And in order to address that, we have, it's something where internally we call our TDM pivot. So we're looking at helping employers to reach out to their employees and get their employees to think about each individual trip they take, not just, oh, I only drive to work alone, that's how I get to work, or I only carpool, or I only take the bus, but to look at each trip they take and think about what's the best mode for this trip today. So if you've got kids and you say, well, I can only drive alone because Tuesdays and Thursdays I pick up my kids from soccer. Well, we've still got Monday, Wednesday, and Friday. Could you do something different on those days? So we're trying to sort of change the way people think and help empower our employers to do that for their employees, because as Metro, we can't reach all the commuters. So we depend on cities, we depend on employers, we depend on TMAs. So we're working with all of these groups to try to get all of the commuters, all of their mobility information that pertains to them. So they know what all their options are, and then use that information to help them change their behavior and realize they have more than one choice. And so that's sort of our TDM pivot to kind of address what comes after, after the vaccine, after people feel a little more secure. We still have a lot of work to do.
That's interesting. From a behavior science lens, they talk about that window of opportunity when there's a big change that's taken place and you have that opportunity to reassess your options. So it sounds like you're really trying to think about how you can develop a strategy for that time and to get into present more options to people. That's interesting. Let's change the tracks a little. Ya-Ting, I'd love to bring you to share some thoughts with us. I'd love to understand a little, as you've worked with cities in the last year, how you've seen sort of public officials reacting to the challenges that they're facing on ground. Low information, rapidly developing situations, a huge amount of gaps in knowledge in terms of how the disease was spreading, and I'd love to understand how did you engage with that change in their needs over the last year?
Yeah, so it's absolutely, hearing sort of Stacey and Jacquilyne kind of reflect on some of their challenges this past year. It really sort of echoes what we've been seeing from all of our public sector partners as well, in this past year of sort of pandemic survival. VIA strives to be the sort of digital infrastructure, right? That's like powering public transit. And right now, transportation is, to your point, Joe, rapidly changing and with increased complexity and having to make sort of fast decisions given a really sort of uncertain and unpredictable environment. And, it's interesting. Yesterday, I was on a panel. I had the privilege of being on a panel with the Mayor Williams of Arlington, Texas, and Mayor Steve Fulop from Jersey City. Two cities that are quite different in terms of population size, density, also like square mileage, and also sort of existing public transit infrastructure. Both cities and both mayors, one of the main themes that came out was how important having this sort of on-demand digital component and piece of public mobility with their on-demand transit service, how helpful it was to have such a highly adaptable and flexible system. So during COVID, and I think Stacey talked about this earlier, right after the initial lockdown, when sort of mobility stopped as we know it, of course, there was a steep drop off in ridership across the board in all modes, right? And then what we noticed, and I think this is the kind of the power of, real-time sort of digital infrastructure to public mobility, is that you can start seeing the pickup in ridership and who needed to travel, to Stacey's point about who were the people that actually did not have the luxury of working from home, who had to still get to point, B in order to provide that essential work. And so to the cities that we were working with, where we provided that kind of on-demand tool and service, they were able to see in real time that kind of data and get all of that feedback and analysis and adjust the on-demand, transit service accordingly. So they really, really, I think the main themes for us and what we've heard across the board is just the increasing need for, one, information, real-time information for sort of fast decision-making and kind of rapid response. Two, the need for flexibility and adaptability, of that system. And three, it is sort of like iteration you know, and not being afraid to kind of iterate and change as needed, which is something that I think traditionally maybe is not what people think of in terms of like transportation infrastructure, right? They think of it as sort of these like big mega projects, something so fixed and what have you. And I think over this past year, it's really sort of I think upended all of those sort of traditional notions about sort of public mobility, fixed versus on demand, you know, and what does it mean to have an actual robust public transportation system that can be highly adaptable, highly flexible, and ever changing.
That's really interesting because as you talked about your 3 points and the third one about iteration, I think you're also touching there on public will or political will and public demand for certain strategies or certain changes. And you know, the situation of last year where it allowed officials to move forward much faster on things that might have taken a bit longer. And I think there's always like 2 sides to the coin on that in terms of who are you being able to get input from in order to take those decisions. So that's really interesting. You also talked about decreasing ridership on pretty much all modes. So let's maybe turn it over to Lucia to talk about the one mode that we did see at some points a big jump, and that's bicycling and rides on scooters. We saw global rise in the sale of bicycles across the world. So we'd love to understand a little bit about your experience in Buenos Aires. Tell us a bit more about the pilots, about how you supported this larger shift towards more active mobility.
Yes, for sure. So to bring a little bit of context, Buenos Aires is a 6 million inhabitant city. It's very big. And over the last 10 years or a bit more, has been introducing the sustainable transportation and has been introducing policies such as the BRT, the public bicycle system, the building of bicycle lanes. We have almost 250 kilometers for bicycle lanes. And we have been able to grow from 0.4% to 4% of the trips made by bike, right? So that is a lot that we have been able to grow in the last 10 years. Nevertheless, as everyone was mentioning here, we experienced the lowest peaks in demand for every means of transportation, except the bicycle. The bicycle is something that kept on stable and even growing in this pandemic. And that is why with the administration, we saw a window of opportunity, as you were mentioning, Jyot. It was very bold for us to think of a strategy that could reach even more than what we had reached in the past years. That's why we decided to create the bike lanes in the busiest avenues of the city. These are Córdoba and Corrientes avenues, which were generally seen full by cars, and the car was predominant in these avenues. We saw also this trend of building bike lanes in avenues in Latin America, but those were temporary ones, and we wanted them to be built to last, right? So it was challenging. We had to build 17 kilometers in 1 month because we had to capitalize the time constraints that people needed to go to their works and to capitalize on that. And after this month, we saw amazing results, almost 200% growth of bikers in those avenues before the infrastructure versus the time where bike lanes were not there. Other surrounding areas that had bicycle lanes did not decrease the amount of bikers. So we can assume these were new bikers that were reaching their jobs by bike. And an amazing result also seen there is that we provided infrastructure for women to feel safer to ride a bike. And we saw that the female riders multiplied by 3, right? So that was also a great learning from this policy. So with this window from opportunity and the decision to be bold, that is the main learning that we had, that drastic times require drastic actions. And this is why we're also from the administration going forward and wanting to reach 1 million bicycle trips a day in the city by the end of the administration by 2023. Right now we are around in 300,000. And we look forward to continue these innovative and bold policies to reach everyone in the sustainable mobility.
Wow, those are some really ambitious goals. I mean, I'm just sort of like blown away by the thought of 17 kilometers in a month, of bike lane. I'm trying to quickly do the math in my head on what that converts to miles. Maybe a little less than half, but still a very impressive number. Yeah. And I'm sort of hearing this theme across everyone that's spoken so far on, actions being able to be taken quite quickly. Though from you, I'm hearing sort of for the first time in this panel, the idea of sort of what was temporary supports that were put up or temporary infrastructure and facilities versus what is a city thinking about how that infrastructure might be used for the long term. So I think that's also a really interesting theme. Talking about sort of the perception of bicycles and scooters, I want to invite Josh to comment. From your perspective, it's been how are you seeing that shift in how bicycle and scooter commuting, whether it's used for commuting or whether it's sort of used for leisure trips? How have you sort of seen that change in the last year?
Yeah, thanks, Joe. I think, it really has evolved into, I'll speak to shared bikes and scooters, into really a meaningful piece of transportation systems where previously it may have seen, especially scooters, it may have been seen as, as you suggested, recreation, leisure, almost exclusively by some. And I think I'll take it in reverse order. With the general population, that was driven by initially as stay-at-home orders were issued and there was misperceptions about how COVID-19 was transmitted and public transit may have not been seen as a safe option as compared to something open air like a bike or a scooter. That kind of drove use towards those systems and helped kind of evolve that essential and utility use of those systems. And then I think as, transit systems had to reduce their service, had to reduce headways and overall routes, then we were able to work to establish programs and partnerships which really help fill in those gaps to maintain those options for people. So as Stacey mentioned, we developed a long-term lease program, which was very unique. We also worked with transit agencies like SFMTA to help fill in gaps where they had to reduce routes or eliminate routes altogether. And then, developing things like a free rides for essential workers program to help support those who needed it most. And so that's kind of helped to cement that idea where, it's not just this whimsical thing to go on and find a scooter and take it for a joyride, but rather it's really, it can be an intentional decision to use it for commuting. This is true of scooters before, like in Portland, in their 2019 evaluation, they found that 27% of people in a survey chose commuting as their primary use for shared e-scooters, which was the most selected option. And so it just kind of further established that as the opportunity with shared bikes and scooters. With employers, we've started to evolve our conversations with them to find opportunities where we could either provide scooters as like an established fleet. We've had some unique opportunities there on campuses, whether it's allowing those who are coming into work to utilize for trips throughout the day or commuting themselves, or in the case of like Edwards Air Force Base, we launched a program there which was really to utilize scooters as a means to get around a very sprawling campus. So unique opportunities like that have presented themselves as well. And then with public officials, I think that perception of scooters as a thing to be regulated and to avoid disruption with has changed into something to be embraced as a means to achieve better outcomes. And so as Stacey mentioned, again, the city of Detroit was very forward thinking of this. Back in March and developing their pilot. We also established a pilot early in March with Portland, or as shelter-in-place orders hit in Portland, where we reduced our fees to users by 50% across the board, maintained our presence in terms of deployment, including in East Portland, which is kind of an area of focus for them as a low-income minority-driven neighborhoods. And then we were able to also continue to deliver these programs like this essential worker program to really maintain a level of service for people and an option for people to make sure that they didn't find themselves without a means to get to work, get back home, make those trips to whether it's a pharmacy or the doctor or grabbing food or other essential items. So that's kind of how we've seen it evolve over the past year, and we hope to continue to do so. There are other opportunities coming, like the Bicycle Commuter Act. We're very excited about the opportunity for shared bikes and scooters to hopefully be included in that as well, to provide pre-tax benefits for those using scooters for commuting, scooters and bikes for commuting. Bicycle Transit Act, which would prioritize bike and scooter shared infrastructure and make that eligible for federal funding. So all of those things are some were in the works prior to the pandemic. Some have been advanced very quickly post-pandemic, or as we move through the pandemic, and we just hope that continues from here.
Yeah, that's really interesting to think about how working from home, how there's been a shift from thinking about how do we regulate these modes to it being considered as part of almost a city's toolkit that can be deployed in flexible ways to address challenges. Let's take a break here and maybe open it up for our poll so that we can get our audience to share their views as well. I'm really interested to sort of crowdsource views. So if you all could go to menti.com, and I'd love it if the panelists could go as well, and type in the code 8866180. I think there are 2 questions in the poll, so maybe we can just give 30 seconds or so on each question. Okay, that's really interesting to see that there seems to be, if I can see the numbers correctly, I think more optimism that a number of these things will stick, but really low optimism that changes to prices and fares is something that is going to be long term. I still see that sort of below maybe the halfway point of 5. All right, interesting. Leanne, should we go to the next question as well? Thank you. So sort of a similar question on what we think will stick, but these are actually strategies or rather initiatives that were taken by cities and stakeholders in the last year that we classified on the COVID Mobility Works website. We saw that, at least in what we were gathering, and I have to say that the platform is more skewed towards US and European initiatives, that it is quite skewed towards sort of modified use of public space. I think also because that's quite a visible change that takes place. We saw a lot of those types of initiatives. All right, I just want to pause there while we've got some responses coming back in and open it up to the panelists if you're seeing something on these polls that you think isn't aligning with where you thought the direction that it would work in. Want to just give you all a chance to sort of weigh in on what the audience thinks. Any thoughts?
This is maybe a preview of what I'll say in the next section, but I thought it was interesting how for the first question, a lot of the things that normally required or were very inflexible, thinking about regulations like speed limits, use of public space that have change has been enabled maybe by response to COVID or has been expedited by response to COVID. I think it'll just be interesting to see as we continue to recover how perception of that will change, and if it reverts back, like if it's clear to people like the benefit and joy of public space and less cars and slower cars and how they might move among them in various ways, whether it's on a bike, on a scooter, or on transit. I think that is something I'm very eager to see. So I don't remember the exact results, but it seemed like there was at least optimism about some of those things sticking.
That's really interesting.
And I can add to that a lot of cities in LA County have started during COVID creating slow streets where they slow down the traffic on residential streets. And I was talking to a city planner who admitted to me that they decided to do it during COVID specifically because the residents on the street are very much for that initiative. Where they get the most pushback is from the through traffic. All the commuters driving down those residential streets to avoid the main boulevards are opposed to that. And because during COVID, those people weren't commuting, they weren't there to oppose the initiative. So they really took advantage of that to implement these different measures. And they figured by the time COVID was over and people were starting to commute again, the measures would already be so entrenched that the residents would not want them removed, and they had a better success rate of keeping those for the future. So that was just sort of an insight as to a trend that we're seeing in a lot of cities, creating slow streets.
That's
maybe building on what Josh and Jacquilyne were saying is that these trends and this optimism, we can also see in Latin America. Like we are also modifying the use of public space, and as I was talking before, the increased bicycle purchase and use. So I think there are global trends, regardless the region, because the pandemic has accelerated some changes that maybe we couldn't do before, but now it's the opportunity and the time to make them happen in different regions.
Yeah.
Jyot, if I may, just to I'm glad Lucia brought up sort of the Latin American sort of experience, and I want to tie it back to a comment you made before around sort of the inherent sort of political nature around all of these sort of policies. And I think that for me, and maybe it's because I'm sort of interacting, with elected officials and really kind of looking at the politics around all of these different issues, is that it really does require political leadership, will, and intentionality to kind of use this moment in time to push back this kind of, I think, default American culture of like driving alone, even pre-pandemic. Like I believe, and I don't want to misquote, but I believe like it was like 97% of Americans like commuted to work like alone, like driving alone in a car. And so there is an opportunity here to really sort of like reimagine that type of system that kind of lends itself to that. But inherently, that is a political conversation and really requires sort of a reimagination and from our leadership.
Yeah. Thanks, all of you. I think that point will be particularly visible when we see cities reacting to whether they continue to keep parking spaces as ways for restaurants or businesses or people to use that space, or whether, sort of as the vaccine rolls out, we see a pulling back from that. I think parking is such a big part of the land use of our cities. And it's something that is so taken for granted that if we're able to rethink how we're using that space, I think it's a first step maybe in that chain reaction of changing our mindset and association of what a transportation system might look like. Talking about making the system better as we recover from COVID, maybe I'll go in sort of reverse order from the first part of the panel. So Josh, would love to sort of think about where you think there are opportunities today to sort of push for that big shift in the transport ecosystem. You talked a bit about integration before. I wonder if that's something that that is really, this is the point to push for integration across modes in the ecosystem today.
Yeah, and I think the opportunity exists with the new administration coming in, and Secretary Pete and others or who will be appointed in his administration or who are already there, and their focus on safety and active transportation, I think will be crucial to this. So, allowing for 30 billion plus to bring back the transit system, the opportunity with the surface transportation reauthorization, and as I mentioned, the other bills from Representative Blumenauer, all of those things coming together to kind of enable this paradigm shift from driving alone being the focus, and like this. You refer to parking spaces. I used to be the on-street parking manager for the city of Minneapolis. It almost felt at times that people had an emotional need for parking. And so pulling that back and shifting that to an emotional need for public space, like the importance of public space that we've found through how cities have reimagined their public space. So like having that come from the top down, and then also just making sure that cities kind of use this moment to maintain those swift and positive responses, reimagining public space for people, and hopefully people also seeing that too, the importance of that, of utilizing that public space and existing within that, rather than having it be taken by 2-ton pieces of metal that don't move for hours on end and don't do anybody any good. So I think that's really the exciting part about this moment, and hopefully both from like the bottom up at the local level and the top down from the federal government, investments and funding and policies are reflective of that.
Ya-Ting, I'd love to bring you in on the same question. And I think, we've heard a lot from this new administration, the transportation secretary, sort of the focus on people, on access, on equity, and on climate. So love your perspective.
Yeah, I think Josh touched on a lot of points that really show, and that sort of at VIA, we sort of firmly believe that, without a doubt, transportation sort of sits at the intersection of all of these things, right? The how we come back from this pandemic, the economic recovery, climate change, and also racial equity, one of the foremost pressing challenges facing this country. And we just think that there is almost like a once in a generation opportunity right now to present a vision of American mobility that is not tied to personal car ownership. And so, for us, like, we don't think owning a car, which by the way is the second highest household expense right now after housing itself, should not be a requirement to access opportunity no matter where you live, in a city, big or small, in a dense or low density area. And so as such, the federal government should also stop funding transportation like we're back in the 1980s, with a heavy focus on large highway, capital projects. And so for us, Josh referenced this, there is a huge opportunity right now and an ongoing debate at the national level around how do we, again, reimagine federal transportation policy. And for us, we have three kind of specific things that we would love to see. One is a focus on goals and not arbitrary funding silos like, highways and transit, but really actually look at goals around greenhouse gas emission reductions, improving actually access of people and not cars, and equity as well, and make funding decisions based on those type of goals. Second is funding transit operations. That is key. So much of the federal funding traditionally has been put towards only capital projects, and which really limits and kind of disproportionately hurts public transit, because usually operations is really the largest sort of expense for public transit networks. Lastly, innovation. I think this is an opportunity. You heard from Detroit, you heard from LA. Lots of cities now are really trying to use all the tools available to, again, adapt, response, get real-time information. And I think the federal government also has a critical role to play there to really incentivize some innovation and allow cities to unlock some of those tools.
Thank you. I can see that we have about 6 or 7 minutes left, and there's a really interesting question from Kevin Ritter that I'm going to pose to the three panelists that represent cities here. So the question is, how might transit agencies continue to respond to the unique needs of grocery store workers, hospital workers, restaurant workers, retail workers after the pandemic subsides? Despite the well-deserved attention we paid to them during the pandemic, they will remain essential afterwards. So I'm going to open it to the three of you, Stacey, Lucia, Jacquilyne, to maybe give us a little insight on how you're approaching this question.
Go ahead, Stacey.
So I personally think that we need to shift our metrics of success. Transit, rightfully so, for the longest time has really focused on operational efficiency, which is great. But we need to go back to who are we serving and why, and how do we best serve their needs. And this pandemic, if anything, has showed us that essential workers, frontline workers who are often Black and Brown, who are often low income, who don't have any other option, that should be our primary focus in our core who we are serving. And so we need to help change the metrics of success that basically demonstrate, transit really means access, and we are increasing access to jobs and opportunity, increasing access to health enabling activities and preventative healthcare activities that can ultimately improve health outcomes, and also then potentially save the healthcare system money, because a lot of our current healthcare costs, which are exorbitant, are focused on emergency spending. So I just think that we need to better shift and how we tell the story of transit, that really it's an essential service, it's an investment in people and the most important people, and not just a service that runs from point A to point B and without any real end destination, which that's not the case.
Yeah, thank you. Jacquilyne, did you want to go next?
Yes, I think one of the things we're doing at Metro is looking at how do we bridge those gaps. We do have a problem in LA County with first mile, last mile. Our public transit system is still growing, still expanding, but there is often that first mile, last mile gap that creates difficulties. It means walking, a long ways, or it means having to take a longer bus connection to get to where you want to go. And I really think that does affect our essential workers. Those are the people really, when you look at it, they work a schedule, and that schedule may change weekly. So, you know, one week they may have a great connection based on time. The next week, it may be a terrible connection based on what time they work. So one of the things we're doing, we have an FTA grant to do a travel rewards research study. One of the things that we're doing is figuring out how to provide transit riders, especially, with a bridge to that gap. So providing them with our Metro has a micromobility program. So free access to micromobility, free access if they don't have that to Uber and Lyft or bike share, knowing what are all the things that they can use. And not just first mile, last mile, but if something happens, if the bus is crowded and it passes them up, or if they work a late shift and they don't feel comfortable taking transit to get home, how can we get them home? So that is part of a pilot project that we are going to be implementing in the fall. And part of that also is something, since my preview is just all of TDM, we're also looking at dynamic carpooling. So instead of carpooling with the same person every day, you have a pod of potential carpool partners. And you can say, okay, I'm going to drive in with you on Monday, and I'm going to drive in with this person on Tuesday, or I'm going to drive in with one person and drive home with a different person. So it gives more options than just transit to those people that work, sort of these essential workers who tend to work shift work instead of regular 9 to 5.
That's interesting. Also, the use of the word pod, I think, conjures up a pretty definite image in people's minds these days. Lucia, I want to give to you the sort of closing statement on this. How are you thinking in your city about supporting essential workers, hospital workers, restaurant workers, retail workers?
Yes. So first of all, I would like to share that in the city, all public transportation is prioritized for essential workers. And as activities keep on being authorized or start reactivating again, we add them to this prioritization. For example, last February, the school started in Argentina, and school teachers and students were a priority for public transportation. And we made a lot of consciousness and communication campaign in order to achieve this, because it's a social responsibility from the whole society. And besides the priority towards these workers, we also think that accessibility is something that should be built upon, and there should be a commitment of the administrations towards that in a sense of equity. And for example, in terms of biking, that is another very good way to use and to move across the city where distances are short, less than 5 kilometers. Of course, building infrastructure in the most vulnerable neighborhoods of the city to connect one point to the other one. Bringing financial aid with the financial institutions like the Bank of the City of Buenos Aires to promote the purchase of bicycles. That is another way that we have been working on. And last but not least, providing during the weekdays the bicycle public system free of charge during the weekdays, in order to achieve more trips made by bike, so that essential workers can use them. So yes, those are the 3 things that we're doing towards accessibility, besides of the priority in the general public transportation.
Thank you so much. We're right on time. I don't have the chance to summarize what any of you said, but that was really great. I believe this session was recorded and will be made public as well. Do take a chance to visit covidmobilityworks.org. Tell us about initiatives in your city that we haven't mapped right now. Thank you all for joining us, spending your time with us. And a thank you to Global New Mobility Coalition as well that helped us put on this panel.